This tutorial will cover the submission process to support the prescription drug transparency reporting requirements. Reporting entities, manufacturers, and third-party administrators can submit new prescription drug and price increase data through the portal. Before we review the portal, let's review the primary functions for item management. Reporting entities can utilize templates for pricing data. The portal will allow users to download a template, add pricing data, and upload the data to the portal. If preferred, users can also key pricing data directly in the portal. Once submitted, data is presented in batches where reporting entities can view, edit, delete, and certify data. Within a batch, items are organized by needing attention, pending certification, and ready for review. We will talk more about these statuses as we review the portal. Now, let's move over to the portal to review the detailed steps for item management. This is the homepage of the portal. Click the Login button to access your account. In the next screen, enter your username and password and click the Sign In button. Once logged in, click on the menu dropdown, then Item Management. The Item Management page has a top navigation panel. Let's review your options here. First, users can download templates, upload a template, and manually add a record for a new prescription drug and price increase. Let's start by clicking on the Download Template option, where users are presented with two options: New Prescription Drug or Price Increase. Select your option, then click the Download button. The Excel file will download and be available in the download bar. The template will include one worksheet for item data and another for instructions. Click the Help tab for details. Each data element, including format, size, description, and a formatting example, is provided. It is important that column headings are not modified. Save the template to your local directory and then populate data. Once a template has been updated with pricing data, it can be uploaded in the portal. Click the Upload Template button. Select Organization from the drop-down menu. This is the manufacturer for which data is being submitted. The batch description field will automatically populate with the batch name. This description can be updated based on user's preference. Next, click Select File. Locate the file for upload. Click the Open button. Once uploaded, users are presented with a screen showing the upload results. This is a preview of the data before it's uploaded. There are two tabs, Ready to Process and Errors. The Ready to Process tab has all items that have met minimum criteria. Warnings are included but do not prevent the data upload. To delete items for upload, click the checkboxes, then the Delete button. Next, review errors. Errors will need to be corrected and re-uploaded. To complete the upload for NDCs that are ready to process, click the Process Items button. Then OK. In addition to batch uploads, users can manually add item data. To manually add an item, click on Add New Prescription Drug or Add Price Increase. For this example, we will add a new prescription drug. The next screen provides a form for entering the item information. Enter all available information, ensuring that required fields are populated. For data that should be treated as non-public trade secret, select the checkbox. Click Assign Statement and enter a written statement. This is the legal basis for designating data as NPTS and is required if NPTS is checked. Click the Update Statement button. If you wish to certify this data, select the checkbox. Otherwise, you will have an opportunity to submit and certify at a later time. Click Save Changes. From the Pending Item Batches screen, users can review uploaded and manually entered data. To review a batch, click on the pencil icon. Items fall into three categories: needing attention, pending certification, and ready for review. For data elements that have the NPTS designation, add statements by clicking on the Assign Statement button. This next screen helps to streamline the written statement process by allowing users to add statements to a group of NDCs and data elements. Select NDCs that will be updated by clicking the checkboxes. Select All or select individual items. Next, select the data points. Then type the written statement or legal basis for the NPTS designation. Click the Save button. Back on items needing attention, users can attach documentation. For data elements that require documents, such as a generic delay agreement, click the Attach button. Similar to written statements, select NDCs that will be updated by clicking the check boxes. Next, select your file by clicking the Choose File button. Select your document. Once attached, click the Save button. Finally, if there are items that should be deleted from the batch, select the items, then click the Delete button. Now let's review items pending certification. Similar to items needing attention, users can edit items, attach documents, and delete items from the batch. To certify items, click the checkboxes. Then click the Certify button. Confirm the certification by clicking OK. These items are certified and will move to the Ready for Review tab. However, they can still be updated or deleted as necessary. These items are now complete and ready for MDH review. This concludes the item management training. For additional information on the Prescription Drug Price Transparency Program, log into the portal and locate the help link in the upper right-hand corner of the main menu. For additional questions, please contact health.rx@state.mn.us.